Good afternoon. I'm Diane Marseglia, Chair of the Bucks County Commissioners, and we welcome you to our virtual press conference. I'm going to actually turn it over relatively quickly to Dr. Damsker from our health department, but I wanted to let you know that Jean DiGirolamo and Bob Harvey, my fellow commissioners, are here, and we will be here to answer questions. And after Dr. Damsker, Scott Forster, the Director of our Emergency Management, will also take questions. So Dr. Damsker, if you'd like to start, and Larry King will read you any questions we have, and you can answer them.
Thank you very much, Commissioner. So as of today, we have almost 100 cases. We are up to close to 2,300 cases here in Bucks County. We do have 5 additional deaths that were reported today, so our total deaths is 123. We have what we've seen, and I mentioned this at the prior press conference, we have definitely seen a shift in the types of cases that we're seeing, from community type spread over to facilities, congregate care facilities, and their residents and staff. And we are seeing usually between a half to 2/3, or even more in some days, cases directly from those facilities, again, both in staff and residents. So while it's a little bit of good news from the community spread perspective, it's definitely not good news from the perspective of congregate care facilities that often have our most vulnerable patients. And right now we're sort of in the middle of that, and we're hoping to sort of ride this out. We have over 50 facilities now in Bucks County that have outbreaks, either staff, residents, or both. And we're working with all of them to try to mitigate this as much as possible, to work with them, to give them the best advice we can, and to, of course, minimize the mortality of any of the residents, which, each single case there's a family involved, and it's a lot to go through. So, we talk about 123 deaths. That's 123 families that are all in mourning and grief, and it's difficult time. So, we're trying to get through this really difficult period, and we're hoping to get to the opposite, to the next part of that, which is where once we get through the situations in the nursing home, if the community spread is also down, then we'll be in much better shape. So right now it's difficult, but we're working with our facilities to make sure they're doing the best they can, and that's kind of where we are with the situation in Bucks County, from a new onset case perspective. Do you want to have Scott Forster give an update as well?
No, I thought, Larry, did you have any questions that are specific to Dr. Damsker?
Sure. Have a number of questions from Joe Chevalier of the Courier-Times. First question is, do you know what date the county recorded its first case of COVID-19 in a long-term care center resident or employee?
They both occurred in the same week, the last week of March. We had our first case in a resident at a facility, and the first case of a worker at a facility, both the last week of March.
Okay. And is the county tracking how many residents and staff in individual long-term care centers are being tested for COVID-19, or are you relying on self-reporting by facilities?
We're definitely speaking to them. We don't have absolute hard numbers of the numbers people tested, but we do have numbers, fairly accurate numbers, I believe, of the numbers of cases in both staff and residents and nursing homes. But it's not easy for us to get negative results of tests because they're not always reported to us.
Okay. And the county has attributed increased cases in care centers and employees with increased testing of employees and residents. When did that increase occur? And is there a concern that there is late or underreporting happening in long-term care facilities?
I would say over the last 10 days or so, we've seen a large increase in testing. Some of the facilities were able to do mass testing on their entire facility based on the number of test kits they had or the ability of their laboratory to do it. Other facilities are being more picky, and I mean picky as in that they have a limited number of tests that they can perform. So they're picking the ones that have the most difference clinically. So if you have a certain wing or a ward or a floor in a congregate care facility, you do a few tests in that wing and you can say, okay, those are positive. The rest of them with the same symptoms are considered to be positive on that wing. And they don't test every single person. Eventually, it would be nice if the testing was easy and convenient. We could test all staff and all residents in every nursing home and get a really good picture about who's positive. But again, it doesn't exist as that, in that way just now. But some of the homes are testing, certain portions, certain residents, and they are getting a good idea as to how many cases they may have, even if they're all not positives.
Okay. And the county stated that 4 deaths that were reported on Tuesday occurred earlier this month. The question is, were they in long-term care centers, and why are they only being reported now?
They were reported to us late because of the way we didn't know about it. If we don't know about a case, there's times where someone died and the test comes back 5 days later and we may not know about it. And there's an individual reason for each of those. Sometimes the state gives us a case. They may have thought it was a resident of a different county or whatever the situation is. But there's usually administrative reasons why we weren't notified until a few days after they passed.
Okay. And finally, what specifically is the county health department doing to oversee or mitigate COVID-19 cases in long-term care homes? Are you sending workers to these facilities? Are you in contact with all licensed facilities or only some? And how many, if only some?
Yeah, of every facility that reports a case of a resident or staff, we do make, at a minimum, we make phone contact with all of them. Depending on what's happening, we may make phone calls daily. We may make phone calls every other day, and we sort of do that depending on the status of the facility. So if a facility needs additional help, they have a lot of cases, they have staffing issues, we talk to them, in more in-depth interviews. We are not sending people out to the facilities at this time. For the most part, we've been able to gather, most of what we need via telephonic methods. But if there was a situation, we do have limited staff available because we're all working on the COVID response here. But there are certainly situations where working together with emergency management, we may have someone go out and do an actual site visit. But most of these things we've been able to tell people about PPE and donning and doffing equipment and cohorting can easily be done via a teleconference.
Okay. Have a general question for the commissioners or anybody else that wants to jump in, also from Joe Chevalier of the Courier Times, saying we would like to get some commissioners about the 3-phase plan that Governor Wolf outlined last night for reopening counties, excuse me.
So I suppose we'll go down the line and each give you just a brief reaction. First of all, we need more time to look at it, but in a brief look at it that I was able to do, it looked pretty fair. It looked like it would give us some flexibility, and it looked like there was a way to measure so that we would know when it was time to move on. I'm going to pass it to Commissioner Harvey, who was on the call with the other counties every day, and he might have a little more to say about that.
Yeah, thank you. Yeah, I just actually got off that call, a noon call with all the 5 southeastern Pennsylvania counties and Philadelphia included in that. And a lot of questions about it right now, specifically around the metrics, the 50 new cases per 100,000 per day. Seems a little bit curious. We're trying to get some clarity on that. Also a little clarity on whether or not the southeastern part of the state is going to be treated as a region, or are they going to be treated as counties individually and Philadelphia individually? So I agree with Commissioner Marseglia. We're happy that there is the plan in place, or a plan, the draft of the plan, and it looks like it has a good amount of logic to it, but we're still some questions about some of the specifics.
Yeah, this is Gene DiGirolamo. First I'd like to just start off by saying I think Governor Wolf has done a really good job in handling and managing this crisis, this coronavirus pandemic that we're experiencing. I mean, we're not going to make everybody happy all the time. And I know there was a rally up in Harrisburg this week with some people calling on to open businesses up here in Pennsylvania. But I think Governor Wolf has done a good job. I lean more towards we have to be very, very careful about what we're opening up. I think the worst thing that can happen is that we start opening up our businesses and everything else too soon. And this virus comes back and we're forced to go back to the very, very beginning. I think that's the worst thing that can happen. So I think we have to make sure that we're safe when we start opening up. And again, as Commissioner Marseglia said, we're still trying to digest everything in the governor's plan. It looks reasonable, but I am also a person that thinks I would love to see Bucks County have the flexibility to do what's best for the residents of Bucks County. I would not like to see us lumped together with Philadelphia and the surrounding counties and be in any way forced to do something that might not be in the best interest of Bucks County. So I think the plan is reasonable. I still think Bucks County needs the flexibility to do what's best for our citizens here in Bucks County.
Thanks, everybody. Larry?
Okay, yeah, a couple of other questions having to do with the governor's order, and I understand that we're still struggling with some of the details and some of the thresholds for where it comes in. But I guess I could generalize. This comes from both Stephanie Yin at WHYY and Aaron McCarthy at the Inquirer. And generally speaking, they want to know if we have a sense of how long we think it will take Bucks County to enter the yellow phase of this, where that we could start to reopen some things. There are some specific questions about when we might get to the prescribed threshold for qualifying for that benchmark, but I think we're still working through the details on that. But I think people are looking for a general sense of where Bucks County might be in the progression of that.
I'm going to hand that to Dr. Damsker, but I do want to say that the likelihood of us getting there is definitely increased by the amount of social distancing people continue to do. But Dr. Damsker, any specific guesses on that?
Yeah, I would say that if we weren't in the situation we were in with the nursing home facilities, I'd say we were much closer. That's sort of the hang up right now as to why our cases are still higher than what we'd like. And as I mentioned earlier, once we kind of get through this very difficult hurdle of our long-term care facilities and the infections there with the staff and the residents, I believe we will be very close to looking at those numbers. Because again, if we're getting 2/3 of our numbers every day from those facilities, when the infection rate starts to go down in those facilities, it'll naturally bring our overall numbers of cases down in Bucks County. I think we'll be able to get a really good sense over the next week or two how we're doing there. And I think that we are pretty close because again, the community infections are way down because, as Commissioner Marseglia said, it's the social distancing and everything else that we're doing. I think once we get to the bottom end of this curve of the nursing home infections, I think we'll be able to make a really good decision pretty soon in the next couple of weeks, I believe.
Okay, and just as sort of as a follow-up on that from the Inquirer, Aaron McCarthy asks if we have any sense whether anybody's indicated whether Bucks could reopen before other counties in our region, or will the entire Philly area be on the same timeline as was the case with the implementation of the stay-at-home order?
I would say that if it's done I agree with Commissioner DiGirolamo as well, that we should have the ability to be flexible, but at the same time, I think it's going to end up being relatively the same, throughout the southeastern Pennsylvania. There maybe have one county that's a little bit less or a little more than the others, but I think overall, you're going to start seeing the trend come down, for the entire southeast PA. So hopefully it won't be much of an issue. But I definitely agree that, if we reach the plateau first and the other counties are pretty close, I would like to be able to, move forward in Bucks County if possible. Again, as long as the other counties are relatively close. I don't believe we'll ever have a situation where Bucks County is seeing no cases and Montgomery County and Chester County have 100 cases a day. I don't think we'll be there. I think it's going to be a whole, the region will go down sort of together, even if a few of us get there a tad bit faster than the others.
Okay, and just as a follow-up to some of the comments that you had about social distancing, the Inquirer and Fox 29 are curious about how people are behaving in our parks since parts of those reopened. Have people been socially distancing? Have the Rangers had any cause to cite some people for not keeping distance?
I can take a stab at that because I did ask. There's two parts. Over the weekend, we had not opened because we opened Monday. So we had problems over the weekend with people parking and going into the parks when they weren't supposed to. So that was a problem. But since Monday, since they've been open, everything has been okay. They've been cooperating with the Rangers. People have been socially distant. So I'm feeling pretty good about it. I'm not sure if Bob or Jean heard anything different. Okay, then.
Diane, I just heard the same thing that you had, that so far it's been going pretty good since Monday.
Yep.
Okay, Larry.
Yeah, some more questions about social distancing from Alex Gross of Delaware Valley Newsfeed. He's saying when the state does open up, what is the possibility of a second wave if we open up too fast?
Dr. Dabsker?
I think at any point, forever, if we stay closed for a year and we decide to reopen in a year and a week, we're going to have a bump of cases. I think that's just natural. I think we need to be prepared for that, because anyone who thinks there won't be a small bump, I don't think they're living in reality. We have a bunch of people that are closed off in their homes, and there are still a few cases circulating in our community, whether it's at grocery stores, whether it's in our healthcare providers that have to continue working. So I do believe, regardless of what business we open, there's going to be a bump in cases, and I think that should be expected. And we're going to continue working hard at the health department and with our emergency management we'll do contact tracing as we're doing right now to continue to maintain the isolation and quarantine that we're doing. It's going to get harder probably to a degree, but I think that we are going to see a small bump anytime we relax the restrictions. Now that said, the whole point is we're relaxing the restrictions with everything different than what we did 2 months ago, right? We're going to be wearing masks. We're going to be social distancing. We're going to make sure that all businesses comply with the guidelines to make sure that they can make sure that the customers are safe, the employees are safe. So I think we'll see a small bump, yes, but I think it'll be a controlled bump because of all the things we're putting into place. And that's sort of the idea behind a controlled opening. So I'm not concerned about it, but I think there will be a small bump, and I think people shouldn't, stress about it because I think it should be expected.
Okay, this is sort of looking ahead to the warmer weather. It's a little bit chilly out there, but it will warm up. And with that warmer weather, Alex is asking whether certain people, especially younger people, will want to be using private swimming pools, playing sports, maybe a baseball game in the street. Would you still recommend against that type of behavior? And if you do, and people see that happening, what do you recommend that they do about it?
Dr. Dabsker, you kind of handle pools. You have some thoughts on that?
Yeah, the pools are an interesting question. Pools in general, the chlorine actually does kill coronavirus, but I think it's very difficult to maintain social distancing in a pool setting. People are sitting together in chairs and doing things that they normally are used to. A private pool, if you have a pool in your home and you're able to keep your own immediate family in that pool, I don't think there's a problem with that. You're being exposed to your family every day anyway. But public pools at this point, I think we need to be careful. And again, it's more about the social distancing. The chlorine in the pool will kill coronavirus. It's a very easy virus to kill, but there's a lot of other things that go along with opening pools and getting a lot of people together in a small area. So I'm not sure that's the best idea. When it comes to playing in the street, and this is assuming we went yellow, correct? Larry, was that the question? Larry, I want to make sure, was this right now, or this is when we go yellow? That's what I missed the beginning of that question.
I think it was just generally speaking that with the warmer weather, people are going to be wanting to do these types of things and looking for some guidance on that.
Yeah, I think that for right now, especially while we're still under the red restrictions, I think people, if they do decide to go outside and do something, it should be with their immediate family that they're already being exposed to. If you have two siblings, if they play soccer together in the backyard or in the street, I think that's okay. They're probably having dinner together every night. They're doing things together. I think it's a very reasonable thing. But we're not going to start recommending that groups of kids get together playing sports because we're still, just because it's warmer doesn't mean we're in any way, shape, or form, we're not changing our social distancing policies. Once we go to yellow and things open up a little bit more, then we can discuss, maybe some of those changes. But for right now, just because it's getting warmer, I wouldn't make any additional changes to our current social distancing.
Okay, and I think you may have already touched on this, but this is from Jim Melwart of KYW for Dr. Damsker. And he asked, you separate the cases from nursing homes and from the community spread, but do you have any concerns that if businesses do reopen, the virus could spread in the community similar to how it is spreading in long-term care facilities?
Yeah, there's a difference between people working in a business and, taking care of people that really, some of these people need full care, whether it's toileting and feeding, and it's very personal space that you're getting into. In most businesses, you're not doing that, obviously, and you're able to maintain the distancing, the appropriate distancing. Whether so you're wearing a mask, you're staying away from people. If you're in a line to pay for something, you can stay away. So the healthcare, specifically long-term care facilities, are often doing things that make you kind of get in someone's personal space, and it's much more difficult to prevent transmission in some of those situations. So I think the businesses, if they follow the guidelines, should have a much easier time of not having an outbreak versus a long-term care facility.
Okay, I think we're finished with all the questions for Dr. Damsker and the commissioners, but there are some questions regarding supplies, PPE, masks, other equipment, and I do know that Scott Forster has an update on that and some other things that his department is taking care of.
Thanks, Larry.
Okay.
Good afternoon, everyone. I just want to touch on a little of the comments that Dr. Damsker spoke about earlier. The Emergency Management Agency and the Health Department is working hand in hand still on this pandemic. Our biggest concerns, as Dr. Damsker said right now, is as we see that community spread going down, is the impacts to our long-term care facilities. We do continue to put out as much PPE as we can. This week, we've been able to give out about 13,000 N95 masks, face shields, and other types of PPE supplies to our emergency services, our municipalities, our long-term care facilities, which include the nursing homes and the personal care homes. But I will tell you that personal protective equipment is becoming very, very difficult to get. And you've heard me say that time after time, but the longer this goes on, the harder it is to get essential PPE supplies that we need. Gowns, disposable surgical gowns, are almost non-existent. It's very hard to buy them. It's hard to acquire them from the Strategic National Stockpile. And I'm going to ask if there are any businesses out there that have disposable surgical gowns or plastic gowns that they are interested in donating. The County Emergency Management Office would be very happy to accept those and distribute them to our long-term care, our nursing homes, our personal care homes, and our hospital healthcare workers. They are in need of these gowns, and we have tried to acquire them, and it is very difficult. So if there are businesses out there that have an interest in donating gowns that you may have, the County Emergency Management Agency is interested in those gowns, and we'll provide them to our healthcare community. Working with those long-term care, personal care homes and nursing homes, we work on everything with them, from ensuring that there's enough staffing to ensuring they have enough PPE. The Emergency Operations Center and the Health Department, we talk to them, many of those facilities weekly. We talk to them together when there are issues so that we can have a common operating picture on how to solve and come up with solutions to their problems. So we are working with those facilities because we know they are vulnerable populations, and we want to ensure that we can take care of those residents in conjunction with the municipalities and those facilities the best we can. We also continue to do our food program. Think about how many people are out of work right now. They're not able to provide those essential things like putting a meal on the table for their children. In cooperation with the Bucks County Opportunity Council, with some of our volunteer organizations, with the school districts, Bucks County is providing 10,000 meals a day to people who may have lost their jobs, may be on a free or reduced lunch program in the school system, or just might need a little help right now. We also know that people want to donate food. If you have canned or non-perishable foods that you want to donate so that we can give it to a family or individuals in need, the Bucks County Opportunity Council is very happy to take canned and non-perishable foods. Things like canned chicken, peanut butter, pasta, pasta sauce, those types of things. We're not asking anybody to bake a cake or cook a meal and bring it there, because those don't hold up very long. But if you have non-perishable foods that you want to help out a family, the Bucks County Opportunity Council is happy to take those foods so that we could provide them. Larry, I'll turn it back to you. A short update for what the Emergency Operations Center and Emergency Management is doing and working in conjunction with the Health Department. And I'm happy to answer any questions if you have any.
Okay, I did get another set of questions from Tom Sofield of Levittown Now, but I think you covered some of it in following up how the county has been assisting senior living facilities. But beyond that, he's asking some general questions about steps the county may be taking to prepare for reopening. And I think this goes along with that. He asked where the county stands with antibody testing and just general COVID-19 testing. Does the county expect to have the ability to mass test as things get closer to opening?
Right now, we have the ability to do the testing that we've been doing. Basically, if people need to get a test, there are places they can go. But with respect to mass testing, we do not have the capability as of today to do that. We did order a certain number of antibody tests. We're still kind of going through the appropriate guidelines and how we're going to use them in certain situations, because they're definitely not great as a point of care test. And that's very important for people to know. The antibody test is not something you want to give someone who's got a cough right now. It's definitely used for longer term immunity. And I think that we need to find the right places for those. But from a mass testing perspective, the county is not ready to mass test on that kind of basis. And we're hoping that we're given some additional support via the state, via the feds to do that. But I think if people need to get a test today, they can. And so from that perspective, I think we're doing better for testing. If someone's got a fever and a cough and they need to get tested, they can do that. But with regards to mass testing, we're definitely not there yet. And we are looking for ways to help get that done.
I would just add, we were on the phone today with a local lab and trying to see if we can start to find different ways to secure those tests. Scott, did you have anything you wanted to say to that? Larry?
No, I think that's all the questions that we have, unless you had some closing comments.
Bob, any closing comments?
I just want to build on what Scott had talked about, with the gowns, and he and I have had this conversation, and I had a conversation with one of the heads of the local hospitals here just a short while ago. It's not unusual for hospitals to go through, 1,000, 1,200, 1,500 gowns per day. Masks, the N95 masks can be steam cleaned. There's different ways of sort of cleaning them. If you really needed to use them again, you can't do that with the plastic gown. So they really are kind of much more disposable in that sense. Now, when all of this really first started about a month ago, 5 weeks ago, we did have a lot of businesses here in Bucks County reaching out to us saying that they were able to help make different kinds of PPE if we needed them to. And I know the news stories, the media has done a nice job of highlighting some businesses and other groups that have made plastic masks and people sewing masks and things like that. I know Scott did reach out, or logistics and the emergency management did reach out to all those businesses who had reached out to us to see if they were able to make gowns, and just none of them were able to do that. And so, you know, I want to make sure people know that that is an avenue we did look at. We've tried to find local sources that could hopefully manufacture those kinds of things. I know in talking with Scott and with the hospital director earlier today, a hospital director earlier today, gowns were going for something like 30 cents a piece, 50 cents a piece a couple months ago. They're now up to $7 each, $12 each, some cases more than that per gown. And again, go back to the number I gave out, you know, which a doctor said to me, you know, up to 1,200 gowns a day hospitals can go through with all of their staff. So you can imagine how difficult that process is. So I'm glad Scott put that request out and is asking people if they have anything that could be used as that kind of a gown to contact the emergency management of Bucks County.
Jean, any comments?
Just real quickly, and again, very proud of the way the residents of Bucks County have reacted to this. Continue to stay at home if you don't have to go out. Social distancing is very important. And it's just great to see the people that are wearing masks around. You know, I think everybody is trying to follow that order. And I think that's really, really important right now. And, you know, we want to get Bucks County open and businesses open as quickly as possible. But, you know, we want to make sure that when we do that things are safe and that we can keep the residents safe when we do that. But we do want to do it as quickly as possible. But continue to do the things that you're doing. We're going to get through this, and we're going to get through this together, and we're going to get through this safely.
Thank you. And I want to thank Scott Forster and Dr. Damsker for taking time out to do this and to make sure that the press and the public is aware of what's happening. I know you are incredibly busy working for all of us. And I want to just thank the press. You have been very patient with these virtual kind of press conferences and working with us. So thank you as well. Thank you.
Okay. Thank you, everybody.